developed a few lumps around your genital area. Again, it's been about 3 months since the last time, and those didn't go away after an extended course of antibiotics. These ones that are there now are close to the same area as the last lot, and one popped the day before, producing some really smelly material. Right now, you're feeling pretty dirty and just embarrassed to go to your GP again. According to Medscape, the scientific information platform for health professionals, there are over 60 conditions that can lead to benign changes like sores, lumps or ulcers in the vulva or vaginal area. And these do not even include infections caused by germs like bacteria, viruses, fungi and other germs. So when faced with a vulval or vaginal lump, how can you tell which means something severe or really serious, or that which doesn't? It might be straightforward in many cases, but in others, even us doctors will rely on tests to work out what's going on. In this video, let's explore 7 different ways vulval or vaginal lumps can appear and identify which symptoms should alarm you if or when they show up. And remember, when we say something is benign, that doesn't mean it won't cause significant medical illness. Instead, it's to distinguish them from vulval or vaginal conditions that come from cancer. Hi, I'm Dr. Sylvia, a consultant in general practice based in the United Kingdom. Let's just get straight into the video. Suppose you have a painless lump or bump that's been present around your vulva for some weeks or months. It's not getting bigger, it's not changing in appearance or doing anything in particular. It doesn't cause you any specific symptom of ill health, although in some people, its size or presence can lead to embarrassment, making them avoid intimate sexual activity. What do you think this could be? If you thought skin tags, a lipoma or a fibroma, you wouldn't be wrong. Skin tags are precisely what that term sounds like, tags of skin. They are just extra bits of your skin and they can appear anywhere on the body. They're usually harmless. It's just their appearance or size and where they are that makes people want to get rid of them. A lipoma is a benign growth of fat cells that develops just underneath your skin. It might grow very slowly to different sizes, and the only harm potentially it could cause is if it grows so large that it's pressing on other parts of the body, for example nerves or the bowel, and that's not really very common. A fibroma is another type of benign growth coming from fibrous tissue, and because we have tissue all over the body, fibromas can appear anywhere. Most often they will happen in the foot, the bone, your blood vessels, the skin, the womb, as it happens in fibroids. It doesn't happen very commonly in genital skin, but if it does, it may feel like a hard lump that can look flesh-colored or pigmented. So let's look at the next case, which includes painless lumps or bumps around the vulval or vaginal area and the rest of your genital area as well. They can feel smooth, but some of them feel rough, and they've been growing to different degrees since they first started. And they feel a bit itchy. Some of them feel smooth, while others are a bit rough. There appears to be more than 2 or 3 in different parts around your genital space. And though they're not painful, you're getting worried because they're getting bigger. Some of them also look darker than the skin around them. You've also noticed that you seem to be getting a bit more of a vaginal discharge than usual. It's not smelly or it doesn't look like a funny color, it's just irritating. What could that be? Well, if you thought of genital warts or a condition called molluscum, you're probably not wrong. Some low-risk strains of the HPV human papillomavirus cause this relatively benign condition known as genital warts. It might develop within around 3 months of having sex with an infected partner. You may also develop warts or sores in your mouth or the throat and in the anus as well. In this video here, I do go into detail about genital warts and the treatment. So if you're interested, please go and check that out because it tells you when you can do it by yourself or when you need to have your doctor or other specialists involved. And the other condition, molluscum contagiosum, is a viral infection that leads to spots on your skin. It is contagious and it it happens more often than not in children. But it could also affect adults with a weak immune system, and in some adults it can spread through sexual contact. Within 18 months, it will usually clear by itself without any treatment required, and usually there are no complications after the infection. Let's move on to case 3. You notice a little bump on one side of your vulva one morning while washing. It felt a little sore and you just thought it would likely go away. By evening, you're getting a little bit more uncomfortable, and by 1 o'clock of the very next morning, you're in so much pain you can hardly sit because that lump has grown so large and painful that you need to go to the emergency room. Initially, it felt soft, but now it feels so hard and you can't bear anyone to touch it. Sadly, this is not the first time you're getting this, and you're now really worried about why it keeps happening. What could it be? So if you thought about an infected cyst or a cyst abscess, you are probably not wrong. This sounds like a cyst that has grown very quickly, and they can grow at very different rates. Most of the time, if you develop a cyst around the vulva, it might settle by itself, but in many cases they can become infected and grow into an abscess, which seems to be the case here. Many types of cysts can happen in the vulvar area. For example, Bartholin's gland cysts, which you can learn more about if you watch this video here, where I talk so much more about this condition and its treatment. Other cysts that could develop around the vulva are mucus cysts, skin duct cysts or paraurethral cysts, all arising from different tissues around the vulval area, the labia and the urethra. Our next lump has been present for some days and feels soft and uncomfortable. It gets a lot harder 4 or 5 days after. Now it's come to a head and feels painful to touch. When you use a mirror to have a look at what's going on, you can see pus on the head of that lump, and you've tried squeezing it but nothing's happening. What could that be? So if you thought about an ingrown hair or folliculitis, most likely correct. This can appear quite similar, but an ingrown hair happens more often with shaving, waxing or tweezing. Sometimes the lump just remains as an inflamed area which eventually calms down, but other times it can get infected and lead to something called folliculitis, which is infection and inflammation of the hair follicle and might require antibiotics. So go and check out this video here where I talk about vulval ingrown hair and other conditions like vulval pimples and milia if you want to learn more about that. Case 5. You've developed a few lumps around your genital area. Again, it's been about 3 months since the last time, and those didn't go away after an extended course of antibiotics. These ones that are there now are close to the same area as the last lot, and one popped the day before, producing some really smelly material. Right now, you're feeling pretty dirty and just embarrassed to go to your GP again with this issue. You do your best to keep clean, bathing regularly, using fresh underwear. You've not even had sex in a year. And you're wondering, could this have something to do with being diabetic or even the fact that you smoke? What could this be? So, if you thought about a condition known as hidradenitis suppurativa, or recurring boils in a diabetic person, or some sexually transmitted infections, I will give you a star. This is one that you should definitely be seeing your doctor about, as are all the rest. It's always important to see your doctor about any new vulval lumps that are getting bigger or that cause any other symptoms or are not going away. But this in particular is an important one to bring to the attention of your doctor, because the treatments might not just be one more antibiotic, and the way the disease progresses may not be a simple, straightforward boil or abscess. It is possible that when you are diabetic with poor control of your blood sugar, you may suffer from frequent boils like this. In this case, you and your doctor must discuss the best treatments to help you maintain your blood sugar levels. This can include both medication or lifestyle changes. But hidradenitis or HS is a serious condition which is often associated with a delay in diagnosis, because it can sometimes be challenging, especially in the beginning, to decide what it is. So please check out this video here. It's the first in a series where I'm doing an extensive comprehensive breakdown of hidradenitis, what causes it, symptoms, and treatment. Case number 6. Now, there are painful sores and blisters around your vulva. When they burst, there's some funny discharge that's coming out. They've even spread around your genital area, even coming up to the top of your thighs where the folds are. They make it terribly painful to wee, and sex is just out of the question. You were too scared to go to the sexual health clinic initially because you just thought it would go away. But eventually, stuff coming out from down below got very smelly and you just knew you didn't have a choice. After all the tests and things were done, the very nice clinicians at the center said that you would probably have saved yourself a lot of distress if you had come when the first symptoms started. So, what do you think that could be? Well, if you said herpes, some blistering conditions like pemphigus, even some other sexually transmitted infections, go straight to the top of the class. Pemphigus is a skin condition where there is a lot of blistering. It can happen in different parts of the body and it's not sexually transmitted. But you can see how when somebody comes with this kind of picture, you might have to think about that as well. It's really important to have a full sexual screen when a sexual infection is suspected to detect other sexual infections that may be present and get the right treatment to prevent complications. Here we go with case number 7. It started as an irritating itch around your vulva that just wasn't getting better. You've been to your local chemist and tried a few creams which they suggested, and then you noticed while you were washing that the skin felt sore and a little bit thicker around some parts of the vulva. But it was when you started having bleeding in between your period that you got worried and went to see your doctor. By this time, you thought it had been around 6 months since it first started. You'd also been having a chat with one of your friends at work who talked about a film that she'd seen on vulval cancer, and that got you worried. Apart from the bleeding in between the period, you noticed that there is a sore area near the entrance to the vagina. And when you rub that area, sometimes it bleeds. What could that be? Well, if you're worried about a vulval or vaginal cancer with that type of symptom, that will be my concern as well. This is one that your doctor should really be hearing about earlier than later. And there are probably enough red flags in the history to give it a clue, but sometimes in life, it's not so straightforward. Vulval or vaginal itching, that's very common. You would often think of things like thrush caused by the yeast candida. It may even be a sign of allergy or sensitivity to a new fragrance or cream or washing soap or powder. There are also skin conditions like lichen sclerosis, which could cause really irritating itching. So if it's been going on for 1 or 2 weeks and you've tried over-the-counter creams like thrush medicine and it's not getting better, it seems to be getting worse, that's really the time to come and see someone so that we can have a look and arrange follow-up. It's also important to be familiar with the way your vulva looks and feels. And vulval health specialists recommend having a look with a mirror at least once a month. This helps you identify any changes early and you can bring them to the attention of your doctor. Detecting cancer early can help in the diagnosis and treatment. As I mentioned at the beginning of this class, there are so many conditions that affect the vulva, and a few of them are pretty straightforward and simple to manage. But if you experience persistent pain, any changes in the size or appearance of the tissues around your vulva or the vagina, abnormal bleeding from a lump or some part of the skin, or abnormal menstrual bleeding, infections that look like boils that keep coming back over and over every few months, an unusual vaginal discharge, or anything else that is out of the ordinary, please don't be embarrassed to come and speak to your doctor about this. Let me know what you think of this class. Give this video a like if you found it helpful, and do consider subscribing to the channel and sharing with a friend. It really helps. It encourages me to know that you're getting value from what we're doing, and of course it helps the YouTube algorithm bump us up higher because it knows that we're providing value to you. If you've got any questions around this subject, please use my email health information service. I'm happy to respond to any inquiries and provide clarifications. The link is in the description box as well. Check out this video here for more vulval vaginal health information, and I'll see you again soon.